My name is Nevzat. I'm the CEO of Cyprus IVF Hospital. We are based in northern Cyprus. So Cyprus IVF Hospital is the subsidiary of Cyprus Central Hospital, which is the first private hospital in northern Cyprus. We've been operating as a private hospital since 1993. And as a IVF hospital, as a subsidiary of the Cyprus Central Hospital, we've been operating since 2008. I joined to Cyprus IVF Hospital 4 or 5 years ago. It was quite small and boutique IVF clinic, but within 5 years we did lots of implementation to provide superior service to all our patients coming from all around the world. And at the moment, we are one of the highest ranked IVF clinic all around the world. Last year, we were awarded by the European Fertility Society for Outstanding Patient Experience Award. Out of 145 clinics, if I'm not mistaken at the moment, which proved that we did a lot with my team to provide the best service to our patients. As a Cyprus IVF Hospital, actually, we are providing all kinds of infertility treatment solutions to all our patients. It doesn't mean that we are only providing very limited service to only heterosexual couple. We are LGBTQ plus friendly hospital, so basically we are providing service to gay couples, lesbian couples, normal heterosexual couples, straight single men, single woman. So the treatment options that we are providing is quite wide range to all kinds of patients who would like to receive the fertility treatment without any discrimination. We providing all kinds of donation programs, including sperm donation, egg donation, double donation, which we call it embryo donation, tandem IVF, which means that we can combine the donor egg and the intended patient egg together, or vice the other side, the sperm donor and the male partner sperm, to create two separate embryo set for them. We also have a ROPA IVF with sperm donation for lesbian couples. Using the high-tech IVF lab with the super experienced IVF team, including the lab and including our IVF specialists. And one of our IVF specialists, who is the head of medical side, Dr. Sarah, she's been in this industry last 30 years. She's been working as a gynecologist more than 25 years, and then on top of that, more than 10 years in the IVF field. And our other doctor, IVF specialist, Dr. Richden, she having more than 15 years experience in gynecologist side, and last 3 years she's been with us on the IVF side. Super experienced lab team. I don't need to even mention about that. To basically overall, Cyprus IVF Hospital is like a high-ranked, superior service quality IVF hospital, trying to cater all the patients who's requiring the fertility treatment all around the world. If we take the numbers from the last year, 95% of our total patients were international. So basically, if I remember correctly, it was 27 different nationalities. Our one of the expertise is basically we know how to cater the international patient. That is our main expertise, because we only performing 5% the fertility treatment to local population. 95% of our patients are coming from abroad, mainly from Europe, USA, Canada, Middle East, Eastern Europe, Northern Europe, lots of patients coming from Australia and New Zealand, South Africa, North Africa, so Central Asia, India, Pakistan. Um, we have patients from Japan, Taiwan, China. So we have a very wide range of nationalities, the patients coming and getting the fertility treatment at our hospital. We speak at the moment 11 different languages to cater the maximum number of languages that we are receiving patients. But we still position ourselves as a boutique IVF hospital. For us, the main aim is not to provide or reach the highest number of patients that we cater every year. The most important thing is to provide the best quality of service, and therefore we try to limit ourselves in terms of the budgeting on the putting more advertisement, because at the moment we are at the limits, the number of the patient that we could cater at this quality. And the most important thing for us is the quality of the service that we are providing, and we don't want to actually lose any side of that part to basically cater more patients. But in a nutshell, this is who we are. And for myself, I just mentioned I'm the CEO of this company. My background is not medical. I'm actually coming from the aviation background. So I worked in more than 4 or 5 different countries in my entire career. And top level executives. I was like CCO in my last position in a very big airline before I joined this industry 5 years ago. But I basically brought all that passenger experience and customer experience and quality control, quality checks, and the basically in the aviation industry, these are the 2 things: the safety, quality check, most critical things. So all that expertise I brought to this hospital. That's why I think with my team, we at the moment we reached that kind of superior quality of communication and the patient care. At the moment, we are in total 35 people as a team that's serving to patients coming from all around the world yearly. I would say more than nearly 1,000 patients per year. So every individual is unique and special in terms of their background. This is demographic. So we go in basically in details of the demographic of the patients. So their nationality, their country that they're living in, which language they speak with. So then we move on their age group, their marital status, their the gender status. Then afterwards, when we filter all these things, then we go into their medical background, then we analyze their medical background in details, and then we assign them a patient coordinator based on their medical background and basically demographic background to provide the best basically patient experience to them, because everything starts from the day one when they request something from us. So when the patients basically knock our door through our channels and they said, hey, we want to get a fertility treatment from you, we basically first analyze deeply that individual, and then based on the result we try to assign them the best match patient coordinator and medical assistant to try to provide them the best service and the best communication from day one. Because the IVF journey is quite it can be a quite long journey. It could be a very stressful journey, and what we try to do with this patient-centric approach from day one, try to remove all the hassles and the barriers to provide them and make that journey quite easy as much as we can, to support them during this entire journey, to to basically fulfill their dream. So that's why, this each individual is very, very unique, and we try to apply this patient-centric approach to take them as a core to our company heart, and then basically based on that specific individual, arrange everything according to their needs and their background. This is not only with the patient coordinator or medical assistant, it is with our logistic team, with our accounting team, because in the background, it's not only to medical side. These people, they book their flight, they want to come here. Sometimes they want to start their treatment abroad in their home country. So we arrange everything in their home country, their blood test, their ultrasound, their medication. So there is a very big team in the backstage, which specifically try to work to fulfill that individual needs. So that is how we call it, like a patient-centric hospital. That is what is patient-centric mean for me. It's not about only doctor who spends 10-15 minutes with the patient and explain everything in details. It's basically all the pillars throughout the IVF journey that actually creating the path for the patient. Each of these pillar has to be patient-centric. This pillar has to fulfill the patient needs. That's what I call this as a patient-centric. So I mentioned this before, that last year when we won the patient outstanding patient experience award, we know that we are doing quite well, but there's always room to improve. Okay, so I am not just going to say that we are doing our best and that's it. No, every single day we are also learning from our patients, and every single day we are doing very small improvements. And I think that's why this led to us to win the award last year. And that was a huge motivation to myself and to my team to basically enhance this and put some more steps on it. And then last 1 year we are working very, very hard day and night to find out how we can serve to our patients in a better way. Some patients, you provide them the same service, they give you out of 10, 9. Another patient can this is 6 for me, because for me I prefer it this way, because this is in my culture. If you do that way, it's not nice, for example, or according to my religion, this shouldn't be in that way. So we are also, learning from our patients as well. So we are trying to improve all the time, every day and night. And last year we put a lot of efforts for that. And from our Google reviews, you can see that we are not getting even a 4-star, 5-star, 5-star, 5-star. And we said, we can push this more. And also after this hard work, to motivate my team, when I saw first time this certification process, I said, why not to get an international recognition from the European Fertility Society, from the experts, about what we are doing as a patient-centric clinic. So when I saw it, and then we got in touch and read that it's going to be assessed and everything, I said, okay, that's good for us to see from the professional assessor side if we are really doing good. Okay, we are getting really good feedbacks from our patients, we can see the results, but why not to get assessed by the experts from this field, from a different backgrounds and everything. So that's why we apply to see if we are missing anything. Sometimes even though we try to look always this, not like that, we said, okay, let's get an external observation and see if we can do somewhere better. And that's why actually we applied for this. We are like a patient-centric IVF hospital since day one, and we are trying to work very hard for that. And for us, we have 4 brand pillars that every small thing that we do at this hospital it has to be aligned with these four brand pillars. Number one is ethics. Number two is transparency. Number three is trust, and number four is we call it a bit with different. We call it qualification. I will explain to that later, but it has to be aligned with our overall hospital qualification process. So these things, when you think about the patient-centric certification process, whatever actually it's our main brand pillar, this patient-centric certification process is checking these 4 plus more if you are really doing it and applying at your hospital towards your patients. So it is very aligned with our brand pillars and our vision and mission. So that's we are working really hard since day one to fulfill always whatever we do, these 4 requirements for this 4 brand pillar, which is really aligned with the patient-centric model. And I think that's why we automatically become a patient-centric IVF hospital anyway, because our 4 brand pillars is everything that we do is basically pushing us to do it in a right way as a patient-centric model. That's why I think we are at this stage anyway now. The certification process was quite intense for myself and for my team, because we never got this kind of certification assessment from external parties before. I'm excluding the quality part from the ISO, but this patient-centric model certification is the first for us. So during the process, the first one was we gone through the online test assessment to see if we are positioned the right way to apply this certification. It's a very interesting one. First, you have to go through the online assessment, and if you pass that online assessment, you can apply the certification process. Even though that part, I was thinking that, oh my God, so it's 100 questions out of 100. How many of them will be fulfilled? And then, if I remember correctly, we were like 90 out of 100, 96 of them we are doing it, because the question were like, are you doing that? Are you applying this? Do you have that? So it was for me quite stressful in the initially, but when we started to do it, we find out that actually, yes, we are aligned with this entire certification process. But at the same time, we learned a few things that we could do better when we started the interview process, the assessment process with the inspector or assessor, whatever you call it. And we received some tricky questions that was like, okay, it's interesting. We don't do it in this way. We do it in a different way, but I think if we do it that way, we could have a bit more insight about that, for example. So it was quite interesting. So we, our result, they were really impressed, but also it was stressful for me and for my team. And also we learned some interesting stuff that we were not thinking about that way, So as an example, I'm trying to find out, they were asking us, do you apply, for example, the survey for male and female patients separately, or is it only, for one survey for one couple? And I was like, oh, we don't do a separate survey for a male. We just do it as a couple. So why not to do it? Yes, we could have more data and more insight. So, it was interesting. We had some learnings from there as well, which I think one of the main aim for this applying to this certification, not only to, oh, we're good, we got the certification. No, one of the main aim was to see where we can improve more, and that's in the first question. That's why I try to explain. We really want to get the inspection from outside to see where we are doing good, where we can improve more, or if there is anything bad that we do, thank God we didn't, but or how we can fix it quickly. That was the main aim. So the question about this, how really I'm doing this, is, to be honest with you, I think the one of the most challenging part of my job is to really align all the team members. This is, including, as I mentioned before, it's not about the medical team only. We are catering not more than 95% of the patients, international patients coming from abroad. So there is a lot of involvement from the all team members. This is starting from our driver, who are collecting our patients from the airports when they reach the Cyprus. That is our first physical face that our patients are seeing and meeting physically. Because yes, we do lots of video calls. They know who we are. They see us. They talk to us a lot until they come here. But physically, the first interaction point is our driver. So even to how to we train our drivers, how they need to speak, how they need to behave with the patient, when they come here to our hospital, when they sit and wait, they meet with our cleaners, they meet our receptionists, they meet with our nurses. When they go to the lab room, they meet with our embryologist, our head of lab, they were our lab assistant, our the genetic specialist. They meet with our patient experience manager. Then when everything finish, they go and they meet with our accounting team to do the payment. So it has, it's not only the medical part, as I mentioned. It has a lots of touch points that patients are actually interacting, to align all of them to be patient focused, patient centric. It is very, very challenging. But we, as I mentioned before, as a brand pillar, one of the things that we have transparency, internal team transparency and communication is the key for us. Number one thing that I will never accept is that lying. So if there is a mistake, there is a mistake. We are human being. We can do mistakes. This is what I say always. Whatever mistake is there, it has to be immediately communicated to the internal team. If there is anything related with the patient, then afterwards it has to be immediately communicated with the patient. We could do a mistake, if there is a mistake from our side, we could immediately report internally. And if it's, as I mentioned before, if it's related with the patient, it has to be communicated with the patient. So that is one of the key things that actually keep us very, very well communicated, very, very well transparency, good communication, to be patient-centric. Every small improvement, every small changes that we do, we communicate with the team, we do the training, and then based on this, they act all together. They're not disconnected from each other. Patient coordinator speaks with the driver, patient coordinator speaks with the doctor, patient coordinator speaks with the accounting. Everything that every touch point that patient go through, they're all communicated to each other. Even the hotel, even our customer survey, we ask about the hotel that they stay, that we book for them, to tell us their experience about the hotel, so we can communicate with the hotel and say that, look, our patient were staying with you, but they were not happy with that, or they were happy with that a lot. So we give the full feedback, even all the stakeholders that we are working with. So it's all about the communication and transparency. That's how I'm trying to work with my team, and that is quite challenging. It's quite tiring, but to achieve these results, we have to work like that. But it's tiring. For us, this is continuous thing. It's not something that we done this improvement and that's it. No, this is every single second. We are learning something from our patients. We are learning their new expectations. We are learning new challenges that they're facing. So we are catering, different patient types. So from each of them, each of this very unique background, we are learning something. So therefore, this is non-stop, continuous improvement every single day. We have a patient experience directory. Our head of patient experience, Yeliz, and her team is only dedicated for the patient experience. So her team is working how to improve the patient experience. As I mentioned, we could do some mistakes, some during the WhatsApp communication, we forget to mention, let's say, the patient coordinator, something about the operation. Small thing, don't drink water, for example, 2 hours before something, and you forget, but there is a quality control there. The upper level patient experience manager can see that, hey, you didn't communicate this with the patient. Can you please immediately communicate? So it's, as I mentioned, it's very tiring because we are working 365 days. But we created this ecosystem that we basically look after to each other. Every team member is there to look after. If there is something missing over there, then there is another team member who take care of that missing point and immediately to replace that or inform the patient or the team member about that. So it's 24 hours. Every single second that I mentioned, we are doing a small improvement. Even one keyword in the emails that we are sending to patients can avoid 10 questions that we are going to receive from the patients because they didn't understand it clearly. It's not about, each time a huge action. Even a key, like a small word that you are using in your email communication can actually avoid to receive lots of misunderstanding and lots of questions coming from the patient. So I definitely recommend this program to other clinics. Why? It's good to first of all to see your current position, because while you're preparing yourself for the certification process, you are basically doing a tidy up. You say, okay, I'm tidying up my room to see if my room is actually needs anything. If I'm missing anything, to find out that. Do I need any new furniture to buy it? So it's like a tidy up process. You just check everything quickly to see if you have everything in process, if you are missing any process, or if you are need to improve a process. So it's like the in-house tidy up process before you apply it. So it's really good to know what you have in your hands and what you need to do. And also during this process, you see where you are good. Okay, so it's like a appraisal for your team. So then it's a good things that you can celebrate, and then you see also what you need to improve more. You see also if there's something missing that, oh, I need to implement that process, into my clinic to provide better service to my patients. So overall, it's very nice as certification process. I definitely recommend to find out where you're standing, what you need to do to become a better clinic in terms of the patient-centric approach, which is really important. It's all about the experience, even though patients, of course, they know about IVF, what is your success rate in terms of the program type, and most of the cases, even though let's say patients receive positive results, of course they come to you with a positive feedback. But we have patients, they receive negative results and they said, hey, you told us our chance is 10%, we tried it negative, but thank you very much, it was amazing experience for us, we felt like we were at home, you took care of us from A to Z. So this kind of, because most important thing starts when you receive a negative result with the patient. And where I always say this, everything starts when the patients get negative results, because this is about how you are going to cater their emotional challenges that time, or as a medical side, what you can to improve more to increase the chances for the next embryo transfer or next cycle. So overall, we are working on that kind of things a lot, and this was a kind of a mirror to us to see what we are doing and what we can do better for our patients. For me, the one of the things that before we apply for this thing, do not rush it. make sure that your team is actually ready and actually you are doing most of it. Don't apply, just to get the certification, push the squeeze the things, because it's very obvious if you're not doing it, you are not doing it. It's during the certification process, they will find out it. And it's not good also for you and your team to demotivate yourself. So first of all, do the pre-assessment, see where you stand, and then prepare yourself. This could be 3 months, 6 months, 1 year, depends. I don't know the stage of the clinic that you're applying, and then make sure that your team feel comfortable that yes, as a team we are doing this and we are ready to take over this certification process. Then go for it, because during this interview you will receive lots of tricky questions. You have to provide lots of evidence about for each question that you are doing. So my simple recommendation is, make sure that you have everything in your hand, that you are already doing it more than a year, I guess. I think that's a quite good timeline. Most of the things are in place and they're settled. Of course, there will be always a way to improve them, but don't just go there to, oh, we can get it, we do some stuff over here. It will not work out, and that will be demotivate you. So make sure that you are really a patient-centric clinic. You are doing the most of the things. Of course, you will have some points that they will tell you that you have to do that, you have to improve this, but just don't approach it as a commercial mindset. This is beyond, and I think something separate than the commercial modeling. Because most of the CEOs, we all the time think about, of course, commercial. It's our job, but the patient experience and patient-centric approach is something quite different. And then you cannot achieve it as alone. It's a teamwork. So as always, everything is a teamwork, but just this is like real teamwork from A to Z, not for a small teamwork. This is a whole company. So if your whole company is ready for it, go for it. If not, don't go for it.